best reason for a hysterectomy, by www.hysterectomy911.com. Are you experiencing problems with your reproductive system such as excessive bleeding or severe pain? Has your doctor brought up the idea of performing a hysterectomy to treat these conditions? Are these conditions the best reasons for a hysterectomy? Hysterectomy is a surgical procedure that involves the removal of the uterus, cervix, fallopian tubes, and ovaries or a combination of these. Undergoing this procedure has some permanent consequences such as the inability to become pregnant and the onset of menopause for women who are not yet in the menopause stage. Given such irreversible effects of this procedure, make sure that you have the best reason for a hysterectomy. Most medical conditions can be cured by alternative treatments that are less invasive than a hysterectomy. Unless you have the best reason for a hysterectomy, it's best to explore these alternative treatments with your doctor first. Most doctors perform a hysterectomy as a last resort. The best reasons for a hysterectomy are those conditions that pose a threat to the life of the patient. If it's a matter of life and death, a hysterectomy procedure would be worth pursuing. Some specific medical conditions that can be deemed the best reasons for a hysterectomy are cervical, endometrial, and ovarian cancer. These conditions are the reasons for hysterectomy in 10% of hysterectomy cases in the United States. Other medical conditions that may merit being the best reasons for a hysterectomy include the following. Fibroids. Fibroids can be the best reason for a hysterectomy if the fibroids are growing so large that they press down on other reproductive organs, which can cause the following: distorted body, pain during sexual intercourse, pelvic pain, and excessive bleeding, endometriosis and endometrial hyperplasia. These conditions involving the uterine lining are some of the best reasons for a hysterectomy. Endometriosis is when the uterine lining grows outside the uterus and attaches itself to the other organs. This can cause a lot of pain and excessive bleeding. Endometrial hyperplasia, on the other hand, is when the uterine lining grows larger than normal inside the uterus. This, too, can cause abnormal bleeding. Prolapse. This is when parts of the reproductive system lose support and sag. Although this condition can often be treated by alternative treatments, it can be the best reason for a hysterectomy if the condition becomes serious. Irritation of the abdominal lining. This condition can cause scarring and adhesions, which can make organs attach themselves to each other. If it's not successfully treated by laser therapy, then it becomes one of the best reasons for a hysterectomy. Do note, though, that even a hysterectomy can cause adhesions. For more information on hysterectomy and related topics, go to www.hysterectomy911.com. Copyright 2009, all rights reserved.